What if the chronic illness you might be experiencing or some kind of disease, or if you know someone, wasn't really about a single infection or a diagnosis, but it's actually about your body's compensation for years of hidden inflammation, toxins, and stress that are kind of stirring around, and it's just coming up with the diagnosis that you might have received. So, Dr. Eric Gordon is on the show today to help break down how modern medical and medicine doesn't really focus on all this other stuff that's floating around. It's missing the mark on chronic disease. So there's a lot of these other factors at play when sometimes there's a black and white answer that doctors are trying to focus on. So we're going to dive into how therapeutic plasma exchange, or plasmapheresis as he calls it, can help really take out a ton of the garbage. But also there's a bunch of other factors that will help you reset your system and help you to get on that path to vitality and restoring balance to your body. So it's not just, killing the bug or going to that source or that thing, but actually treating everything as a whole. So we're going to dive into it. Dr. Eric Gordon's fascinating. He has deep knowledge in chronic disease and all of these other factors. So let's jump in. Do you prefer Dr. Gordon, Eric, Dr.
Eric
Eric?
is fine. Yeah, no, I
Eric.
don't like Dr. Eric. I'm
I
too old
thought
for
so.
that. When I grew up, only pediatricians and chiropractors were Dr. Eric. So,
That's true.
Eric,
That's a good
Eric
point.
is
I can name a couple too.
yeah, Eric is fine. Yeah.
Awesome. Thank you. Yeah, that's great.
So tell me, yeah, give me a little background, like
Mhm.
where are you coming from, so I have a better idea.
Yeah, absolutely. So I'm hosting this show with Dr. Savage. He's been on many times, but I more lead it as the guy who's not the doctor.
Yeah.
But at the same time, I have a lot of interest. I have a lot of background in doing this kind of stuff now, going through TPE program myself. But it's to get the information about what's happening in the world right now from your perspective with toxins, disease, what we can do, preventing it. How can we go and seek the right kind of help? So, TPE or plasmapheresis is a portion of it, but that's not what we focus on all
Yeah,
this.
okay.
Yeah,
Yeah, I focus on it. I mean, these days, yeah, just to because I'm still trying to figure out how to use it best for these folks, basically.
yeah,
I mean,
sure,
it's just not clear. It's amazing, but but only sometimes. So,
right. Well, and it's been modified. Well, it's been around for something like 50 years or so,
oh
right?
yeah, more than that. Yeah,
More than
since
that. Yeah.
since the '60s. Yeah.
There you go.
Yeah.
Yeah.
Yeah, I mean, but it
So,
really wasn't used a lot, I mean, until the 80s. I mean, the 80s, before that, it was mostly just to harvest cells and treat a
uh,
few severe autoimmune diseases. But in the 80s, it started to really become a thing for autoimmune diseases. For people who are chronically ill,
yeah,
plasmapheresis is helpful, but is not what I say, it's not the main course. It's not going to do, I mean, because that's what, I mean, obviously, I do it and I love it and I think everybody should have it. But what I don't want is people who have limited resources running out and doing plasmapheresis as it by itself, expecting to have a wonderful response. It just doesn't
that's
work
right.
that way. I mean, like, again, somebody who's young and healthy or even older and healthy, yeah, just randomly doing plasmapheresis is going to help.
Mm,
Better doing it as part of a whole process. I mean, that's what I really like what Paul's doing and why, we can support each other because I think he understands that
yeah,
this is not a standalone therapy.
that's right.
Yeah,
There's a whole protocol.
yeah,
Yeah.
a lot of people are selling it as like, oh, just come do plasmapheresis, and
Hmm.
it's just too expensive. It's not like you're getting a
It
vitamin
is.
C IV.
No, it is cost prohibitive.
What's really changed is something has happened in the last 20, 30 years to get people sicker because we never saw young people
Mm,
sick as much. I mean, we never, I mean, it is just mind blowing the amount of young people, like diabetes, we can blame, directly on the diet, but there's so many other things that are happening. The cancer rates, I mean, and the autoimmune disease rates, I mean, those are real because I've
mm,
been doing this for 45 years and we just never saw these things in young people. I mean, it would be like once every decade you'd see a person under 40 with colon cancer. I
yeah.
mean, just like, like you were kind of shocked. It was the last thing you'd see. And now it's happening regularly, and so it's something something is different in the world. And I think plasmapheresis, unfortunately, because of the difficulty and the cost of it, isn't the answer. But I think it might help point the way to the answer if, as we start seeing it make a difference in people's health, of how important cleaning up the environment is, which is kind of daunting because nobody's willing to spend the money, and it looks like we're going full steam ahead with the idea that there's, and you see, there's the people who are pushing whole foods
Yeah,
as a good idea, which I agree with. But then there's still a bunch of people in the food sciences industry who just feels a chemical is a chemical. And,
that's
like
right.
if the molecular structure is the same, it's the same, and they forget that there might be some validity to that, but it comes with a whole lot of other chemical structures associated with it. That's why whole foods are so important in organic foods, because of what we hope the other things are there, not just the protein, not just the
Yeah.
tryptophan and methionine, or the branched chain amino acids that all the athletes and bodybuilders want to be taking, but it's the trace minerals.
Mm.
Because I think that's one of the unsung heroes, I think, of where we have to go. And in this world of tying it together with plasmapheresis, I would say like the trace minerals are what's missing if you do plasmapheresis and don't feel anything.
Hmm.
Um, I mean, there's lots of reasons that can happen,
I'm
but
sure. Yeah.
if your health is really stuck and you're like, you've tried the vitamins and you've tried a healthy diet and you're still not moving, there's a good chance you've got low level, or maybe not so low level, chronic inflammation in your GI tract. And
Mm.
one of the basic protective mechanisms of the body is to hide trace minerals in an acute infection.
Oh,
And the
wow.
magic word is acute infection, because that's how our immune system was designed. Most immune systems in the animal and in the plant animal kingdoms are
Yeah.
designed to deal with immediate threats. They don't do well with chronic threat. And we weren't wired that way. It was
These
like,
overwhelming threats that are always pushing on our bodies, and yeah.
yeah, you beat it and survive, or you don't and die. And that's why, like, things like, so the idea in the gut, you turn off the transporters for the trace minerals. I mean, iron, molybdenum, manganese, rubidium. I'm just about 10 or 11 these trace minerals that are really important. The reason they're so important is because all your vitamins use trace mineral cofactors.
Mhm.
B6 without zinc and magnesium isn't going to do much. And I mean, and then, it just, you don't make, if you don't have selenium, you're not going to recycle your glutathione. I mean, it goes on and on. Every vitamin and almost every enzyme in your body, not every, but most of them, have mineral cofactors. And luckily, we start off with a fair number, but with a chronically low level inflammation in the gut, which many of us have, um, these diminish. And medicine is designed to find things that are overt. Like, you go to the doctor, if you have anemia, they go, "Oh, you have a problem."
Mm.
But
Yeah.
if you don't have anemia, you're fine. They're not looking a lot deeper under the hood at more subtle things, because we were always taught that, when people have vitamin deficiencies, it's obvious. People have vitamin C, they have scurvy. I mean,
Oh, yeah.
not no thiamine. Your brain isn't working. You've got you know real problems finding words, and you're getting demented. But there's lots of subtle deficiencies. There's lots of subtle illnesses that aren't paid attention to. And so bringing this back to plasmapheresis is that we have to make sure that those things are intact. They don't have to be perfect, but we should be looking for them and addressing them. And especially in the world of chronic illness, because those are the people that's really going to probably be operating. If you're fairly healthy, even if your gut is a little inflamed, your body's probably compensated. You're doing okay.
Right.
You know,
Yes.
but
Yeah.
if you've been not feeling well for 3, 5, 10 years, that compensation is failing. And so then if you go and say, oh my God, I saw it on YouTube or wherever on
Got an idea somewhere. Yeah.
yeah, plasmapheresis is going to save me, is going to heal me, and I go, whoa, no. And I think that's the point. Is, as we said right in the beginning, plasmapheresis is an adjunctive therapy. It's something that will help get you going. It will help maybe set you up to have a better response to therapies, but it's not a cure by any means by itself. It's just something we have to figure out how to add in, when to add in, and how to prepare you. So you're going to, because it's so expensive, we want it to be the most effective, And
That's
so
right.
I don't think many doctors thought about it at all, at least I didn't, as something that would actually remove toxins from the system. Well, to be fair, the idea of toxins is new to how do you want to say, conventional medicine. Okay,
Hmm.
naturopaths have been talking about toxins since they were naturopaths. Doctors in the for the last forever talked about toxins, but somewhere around the 40s and 50s and 60s, we started thinking, toxins are, a poison,
Yep.
but that there was anything low level toxins that kind of fell away, and we got into this black and white world. And I don't think people understand this, where toxicology and the study of toxins, they were just looking for the amount that would like kill 50% of the test animals. That
So
was a
like
toxin.
mercury or something
Yeah,
like that.
exactly. Something, and even mercury they ignored for a long time. But
Good
but
point. Yeah.
but
Yeah.
but they got it. They did. But it was a
Mhm.
slow concept. I mean, we thought people could tolerate much higher loads. I mean, lead is a great example. In the, I think, 70s and 80s, like 70 parts per million of lead was okay. And now we know that there's zero, is really okay. And 5 is not good for young brains. But we just didn't get it because the attitude was if it didn't kill you, it wasn't a problem.
Gotcha. Yeah.
And
As long as you're living.
yeah, and that's and so doctors thought toxins were old-fashioned concepts, basically. And that's why it's been such a difficult conversation in the last 30 years to try to start talking about all the chemicals that are being introduced. Because, look at dioxin. I mean, everybody agrees that and, they had pictures of, I forget which New York State governor it was, like drinking a glass that he said was full of dioxin. I
Oh
mean,
man.
because at lower doses, it didn't do terrible things, and it parts per million, parts per billion sounds like not much stuff.
Yeah.
But if your body doesn't get rid of it fast, it can cause problems. And, again, if you have one toxin, it's one thing. But if you're exposed to 80,000 toxins, start to add up and they start
Yeah.
to make a difference. And this is just a conceptual problem in medicine. I keep coming back because I want people to understand. This is to give me an audio a chance to talk about one of my favorite subjects is why doctors don't understand chronic illness.
You just took the question out of my mind or out of my mouth.
I mean, doctors in general are smart and they want to help. Okay. There are very few doctors who don't really want to help the person in front of them. And so if you go to them and you have been feeling miserable for a few years and you go and they kind of like look at you like, well, you're probably just depressed and you should walk a little bit more and you know take a little antidepressant and you're going to get better, and you want to strangle them.
Mm.
It's because they don't understand what's going on with you, because they were trained looking for what I call, it's the bullet theory of medicine. They were looking for the event that made you ill.
Mm.
Pneumonia, stroke, heart attack, accidents, broken legs. A happened and then B happened and now you're sick and now I'll fix you.
Clear correlation. Yeah. Yeah.
Correlation. You've got right lower quadrant pain, you're nauseating, you're vomiting, and it hurts when we poke there, and you have appendicitis, we'll take it out, we'll give you some antibiotics, maybe you're going to be better. That's how medicine thinks. That's what they want. You have, kind of diffuse pain in your stomach that sometimes is there and sometimes it makes you, it's really bad and sometimes it's not so bad and it's not clear what food causes it. And you get short of breath sometimes, but not all the time. And your right shoulder hurts on Monday and your left knee hurts on Thursday. Doesn't make any sense to the doctor you're talking to. Okay. And it's not because they don't want to help, it's because they were trained to find a fixed deficit, something that's broken, and something that's abnormal on their blood tests. And their blood tests are ones that are designed to find things that will kill you. So, like most everybody gets what they call a comprehensive metabolic panel that looks at your electrolytes and your kidney function tests and your liver function tests. Okay. People with chronic illness, most of them are pretty normal on that test.
It's not going to spot it.
It's not going to spot it because they're not dying. They might feel like they're dying, but they're not dying. They just feel miserable. They can't function. They can't think straight. They can't live their lives. But I can tell you, because I've taken care of those people for 30-something years, they don't die, okay, easily. Unless, unfortunately, actually, suicide is actually probably the most likely form of death in people with chronic illness who are, under the age of like 70 or 80 who are going to die anyway. But, these illnesses make you miserable, but you can keep living and breathing. So anyway, the point is you still see your doctor. Your blood count is normal. Your metabolic panel is normal. Your MRIs are quote unquote normal. They might be a little off. One of the famous signs is like, people will have, they'll get their cervical spines x-rayed and they'll be read as normal. But they'll mention that there's straightening of the cervical lordosis, which is a fancy way of the curve that's normal in your cervical spine. But many people who've been ill for a long time, who've had a minor auto accident or just are a little hyperflexible, they'll have cervical spines that look like a stick.
Oh, wow.
And the radiologist will comment often, straightening of the cervical spine, but that's it. Normal. And so your doctor, normal and it's not normal, but it's not quote unquote pathologic to the physician. Okay, so that's our problem. And this ties into this whole toxin thing again, is because these exposure to these toxins often don't present with a clear-cut picture. Okay, because if you have mercury poisoning to the point of you're near death, yeah, maybe, or arsenic poisoning or lead poisoning. But if you've just got enough that it slows down, because these things kill you by binding, like for mercury, it binds a lot of sulfur groups in the body, and those are really important in a lot of your enzymes. And so organs don't work well, nerve cells don't work well. You get all kinds of like these odd symptoms, burning, tingling, numb, but your blood tests aren't bad.
So that's more like a neurological thing, right?
Yeah,
Something's happening. Yeah.
You'll get lots of neurological findings, but they're not something you go to the neurologist, your reflexes still might be normal. And you can still walk a straight line, and your MRI is still normal. So that's what's wrong, why it's so, not wrong, but frustrating with modern medicine is because our tools are magnificent at identifying clear-cut pathology. And they're not, the good news is we're getting more and more tests that can show us imbalances in immune function, imbalances in cellular function, that are much more subtle than the tests that the doctor normally runs. But they're still slow to get into the mainstream because they're much harder to interpret because they're not black and white. It's not like that one test is really wrong. It's just these tests that show how your body is like metabolizing fats, how it's burning fats, looks a little slow. Okay, but when we look at those tests that look at fatty acid metabolism, the normals and the abnormal ranges were designed for what we call inborn errors of metabolism, meaning a genetic defect in how your body can metabolize fat. But if all you have is a functional problem in metabolizing fat, meaning like you don't have enough carnitine, or your mitochondria are kind of turned down because there's an infection in your body, and they're doing what they're supposed to do, which is not feed the infection. Well, they're not burning fat like they should, and it'll show up on these tests, but it's not abnormal. It's just a little higher than it should be. And again, that's still normal. So I know I'm going on lots of areas, but I'm just trying to show people that the frustration you have with your physician is not their fault. It's how we've been trained. We've been trained to find broken things, and now you're dealing with just things that are not working optimally. But if you've got 2, 3, 4, 5, 6, 7, 8 things that aren't working optimally, you can feel pretty terrible, because it's not, they multiply. Each system that doesn't work well puts a bigger stress on another system.
I'm curious, Eric, was there a turning point when you realized that this is the case, where most modern medicine, like you said, just isn't looking for all the factors that, was there a specific patient or occurrence that you can remember that kind of flipped this on here?
It was no, I think I'm just I'm a bit of a Pollyanna. I believe people.
Ah, I
Okay.
see.
And you're trained in medicine sometimes to be like it's an very old TV show, Peter Falk, Columbo.
Oh
Nobody
yeah.
will know who that is. It's terrible when you get old. All your references are like so outdated. But anyway,
Yeah.
his famous line was "Just the facts, ma'am." He was a detective, and
Yeah.
that's how we were trained, just the facts. And so for me, I liked story. I would listen to people. And that's when it became clear. This is early on in my training. This black and white medicine didn't take care of it. Was great in the hospital, because usually when people wound up in the hospital, it was black and white. There was an organ that we could see on the X-ray or the MRI, or had a lab test that was clearly abnormal. But when they got home and they still didn't feel well, the test had gone back to normal, but the body still wasn't functioning well.
Yeah.
And so that's what got me into just listening and studying and going down the path of, it's really studying health. And this is the same thing when, the biohacker world today. I always like to think about them because I learn a lot from them, but basically they're doing the same things we did to treat people with chronic illness. But it's just, you put it in the context of people who want to stay healthier. It's the same idea. You got to clean up the body. You got to detox them, because, when you're really sick for a while, you haven't taken out the garbage.
So garbage out first.
Yeah,
Yeah.
garbage out. I mean, like, people have COVID and they're in their home and they're lying and they're in bed for a week. Usually not vacuuming the house and putting, it gets a little messy.
Right. Yeah, of
Your
course.
body does the same thing, and then just to tie it in with plasmapheresis, that's why plasmapheresis can be so helpful for people who've been ill for a long time, because it takes out the garbage. It begins
Hmm.
to help you recycle. But I'm saying is that just taking out the garbage doesn't make you well.
Right.
but,
Yeah. Correct.
but there's often a lot of garbage, so you have to do it in steps. But so going back, it's I think what's changing medicine, what's going to change medicine, is people understand and they start to think more ecologically about the body rather than in this black and white, kind of thing. And it's, that it's a system, and it's a complex system. And I will, and to remind people, when everybody's talking about root cause medicine these days,
Yeah.
it's often not the root cause that's keeping you sick. It's the root compensation. Okay. Because, in my world, we treat a lot of people with chronic fatigue, and chronic Lyme disease is one of the things that we've been involved with for 25 years or so. What happened, what I saw early on is that if you see people in the first, 6 months to 2 years, maybe 3 of Lyme disease, you go in there and you kill the bug and people get better. It's really kind of cool. But so many people, that didn't work. And it didn't work because the bug likes to live in your body. And so it causes your body to compensate, to like, spend more attention on a different kind of infection, and it just changes how your body deals with chronic inflammation. So it's a compensation for having the bug there.
Yep.
And so even if you do get rid of the bug, sometimes the body's in that habit and you still don't feel well.
And would that be more inflammation popping up in your body and essentially, yeah, it's trying to keep the bug alive, right? Or
Right.
the
It's
bug's
trying to
trying
get,
to stay alive, that is.
yeah, yeah, exactly. Because you remember,
Yeah.
is that it goes again to this, black and white view of life, is that if you have an acute streptococcal pneumonia, you know,
Hmm.
and well, you either get better or die usually within a week. You know, I mean, it
Wow.
might take 6 weeks to recover completely, but it's that first few days when it's a battle for survival. Uh, you know,
Right, right. Yeah.
but with Lyme disease and Bartonella and Babesia and all these other bugs, these are bugs that actually have evolved to live with us.
Yeah.
I mean, so they don't. It's usually not a fight to the death. It's a fight to like, okay, how can we kind of dance together? So
Mhm.
it's many times it's sort of like having a bad neighbor move next door.
Yeah, yeah, yeah,
And how are you going to deal with that? Are you going to be, are you going to try to be conciliatory and
yeah,
try to tame the relationship and maybe you can live together? I mean, I
yeah.
guess you can burn the house down, but that
Well,
doesn't work
well,
well.
that's another path. Yeah, that's
And the immune system is often in that same place. Is that, again, the initial response is they see the bug, they get rid of it if they can. But
yeah.
once it establishes residency, once it's in the tissue, it's not as easy. And so then, many people, because, learn to live with them. And whether this is good or bad, I don't know yet. I mean, I think but it does work because we see lots of people when we test family members who are healthy, who clearly have infection, but there's no symptoms now.
Interesting.
So anyway, I
Well,
won't go down that rabbit hole because that's a deep one of whether we should treat, because we know that these chronic infections in some people can lead to maybe dementias later in life. Because
mhm.
but it's so hard to say because like
Yeah.
the viruses that we know that can increase the likelihood of like MS, like Epstein-Barr, but
Yep.
90% of people carry Epstein EBV in their bodies, and only a tiny, tiny, tiny percentage is that triggering MS in. So, do we eradicate EBV in everybody? I mean,
Mm,
so
interesting.
I don't want to confuse people, but medicine is confusing. Okay, that's my final line for the day. Is
Medicine
that
is
like
confusing.
black medicine is not black and white. Health is not black and white. We have been trained to think that somehow there is the way to live and the
Right.
healthy and life.
It's everyone's different, right? Yeah.
Everyone's different,
Yeah.
and that's the other problem with medicine, because medicine wants everybody to be the same,
In a
you know,
box,
in
right?
the
Yeah.
box. And that's
Yep.
why they throw out very good therapies when they
Mhm.
test them, because they only work in like 30% of people. Too often, it just gets shelved. Nobody looks back at those 20 or 30 responders. They say, oh, it's placebo. But no, those 30% of people, your therapy was what they needed. But it's
At that
that
time.
their biochemical or genetic individuality. And we don't have time for that because medicine wants to, is in the, you know, it's still in the industrial age.
Yeah.
That's the thing. Well, medicine remains in the industrial age, and we are now in the age of information, and medicine is just beginning to get there. The concept of personalized medicine,
Right.
and it's coming. The advertisements might be a little premature, but it is coming, and I think
Yeah.
that's a hopeful message. If you want to wrap this up on a hopeful message, um, as we are learning to use more information, and that's really where the AI comes in, because there is too much information in your genetic test for any doctor to make any sense out of it. I mean,
Absolutely.
there's too
Oh
much
yeah.
the new tests that measure your microbiome. I mean, no,
Sure.
like nobody can keep that in, I should almost nobody can keep that in their head, and not even in their head, but understand, because everyone has a different balance.
That's right. Well, there's the toxin test that I've taken that we talk about, and I mean there's hundreds, yeah, over 100 that are tested, and each person's different. Then you figure out, okay, where am I high, where am I low, middle, where did that come from? Maybe do some personal research and kind of try to figure, oh, what can I change in my environment around me now, knowing that this is in me, and got to do so.
No, and you're right, and that's the perfect example. And I'm one of the people in my office just built a tool. You see, AI built a tool
Cool.
for
Yep.
me to go through some of those toxin tests for just that reason. Is because, like, no, I don't remember I mean, forget about every. I mean, like you say, like the 80 to 100 toxins we can measure.
Yeah.
Where do they come from? What do they do in the body? I mean, it's just too much information, and so we need to rely on these new tools to help us. And and it's an exciting new world, if we don't make ourselves too crazy about it on the way.
Well, that's the thing. And I have actually built an AI for Dr. Paul Savage, and I threw my toxin test in there, and it's pretty amazing. Yeah, it said almost similar to how he talked through my test personally through the human Dr. Savage. So it's pretty
Well,
fascinating. But yeah, AI.
I'm impressed with him, because I tell you, I would have bumbled my way through it, because that's why I need, because you see, it all depends. Our knowledge bases are all different, and we
Yeah,
need
yeah.
them all. And that's
Okay.
the beauty of AI, is we can get to share them. And I
Absolutely.
think we
Yeah.
still need, well, for at least for a few more years, we still need these old brains to, like, kind of like
Oh yeah.
fuddle around and say, like, this is really more important for you, because that's still, at the end of the day, you have to make some choices, about what's right for your body, and I guess that's always personal, but it's nice to
It
have a
is.
little bit of guidance.
Yeah, well, definitely, certainly, and we need the humans and the experts that are doing this and have been around. And this is where I want to go, Eric. And before we kind of start to wrap up here, because
Yeah,
you
yeah.
said a lot of
We're
great
done. We're
things.
done.
No, but you work with a lot of folks with chronic disease, like you said,
Right.
Lyme and autoimmune diseases. And not everyone listening might be in that scenario. But what are the things that, if we're talking maybe more high level, like what are the pillars that I don't know, what you focus on when you're speaking with a patient that might be in that position or leading that direction? Are there a handful of things that you always recommend?
When it comes to chronic illness, the pillars are really making sure that you're still not in the middle of something that's irritating it. Okay. I
Hmm.
mean, it's kind of, I mean, that's where, over the years, mold and mast cells have become so much in the forefront. It's not that, unfortunately, it's not the end all. It's not the story that's going to get you better. But once your immune system has become dysregulated, mold can be an issue, and it's very frustrating, because you could be the only person in the home
Wow,
that
really?
is reacting, because it's not like again, you're not dealing with a poison gas that everybody's going to react to the same and fall down dead. No, you're reacting where one person who already is inflamed is going to find themselves where they have headaches, they can't think straight, they have burning, they've got weird. Mold can give the weirdest neurologic symptoms, the things that will really make the ER doctor look at you and think you are just
Yeah,
Looney Tunes.
yeah,
Okay, so
crazy town.
that's nothing that I've ever heard of in medical school. That you can't have these burning pains all over your body, or this deep sense of inner tremor. But yes, you can. So I just want to. So it's not that everyone has mold problems, but that's one of those things that needs to be at least investigated and thought of first. Because if you're living in mold and you're sensitive to it, everything else we do will fail or will only work a little bit, and you will waste a lot of time, money, and life energy. Okay.
So is mold almost like the apex in your mind of like if that's not solved, then it's kind of affecting all these
Yeah, well,
downstream.
exactly. Yeah, it's not that it's the worst of anything, but it's the
Right.
thing that's gonna, if you are sensitive to it. This is the thing. I
Yes.
mean, if you're not able if either you're allergic sensitive, which not that much, but if you have problems processing mycotoxins and they are affecting your nervous system is going to stay affected no matter what else we do to you. So you're not going to get any benefit, and you're going to think things aren't working, because you're still feeling terrible, if that's a layer. So I just always think that has to be thought about. Not everybody has it, thank God. I don't want, but if you have to look there. And then the other thing I mentioned was this mast cell activation thing, which, again, it's the same thing. It's part of the body that's making too much noise. And as long as it's making noise and alarm bells are going to go off every time you try to do something, you can't move forward because you're going to keep going back into the and this is the biggest problem, is that when you've been ill for a while, your self-protective mechanisms can start to come out as anxiety and even OCD, because those are self-protective things. They're not.
Wow.
It's anxiety means pay attention. Well, pay attention is what we do when we sense there's danger around. So it's not bad. The problem is it doesn't turn off. Okay. But it's not turning off sometimes because the danger signals don't go away. If you have, a little dysautonomia, meaning like your autonomic nervous system isn't doing what it's supposed to do, which is operating quietly in the background.
Right.
And suddenly you're sitting here and you get a whiff of something, or you get an idea in your head and your heart starts to pound. I mean, like if my heart started going 110, 120 beats a minute because I'm sitting here, I'm going to feel like something's really not right. It's going to be frightening. And imagine if that happens to you 10 times a day.
And there's a lot of people that live that way, just consistent.
And so that's why, and mold and mast cells can be an irritant. I mean, again, it's not the cause of the dysautonomia, but it's something that will often keep it going. I mean, occasionally it's the cause. Many times the dysautonomia has happened for structural reasons or infections affecting the nervous system. But once it's going and you have another threat, which is a bad smell, a bad thought, it can take off on its own, and you're kind of high and dry, in this place of fear. So anyway, so that's why it's so important to deal with these things that will tend to set us up to be easily triggered by our environment. Because if you can't relax, the final healing signal has to come from the nervous system that it's okay.
Yes, you're safe.
Yeah, it's hard to get to that okay spot if your inner body, if your gut is feeding you nausea signals all the time. I mean, that's another thing that happens to people with these dysautonomias, is that they get scoped up and down, and they get put on these on bad drugs for long periods of time that aren't helping to try to suppress stomach acid when it's a nervous system problem. But the nausea, it is these are the primary survival signals. Your dog eats something bad, it throws it up. I mean, this is how we're meant to survive. Is smell bad, stay away from. Chew, throw it up.
Yep, it's the body trying to avoid the bad stuff.
The bad stuff. Heart's beating fast because it's doing that because it thinks it's running, but the rest of you's not moving.
Man, that's so tough to pinpoint, because I've known a handful of people, but specifically with mold. And like you said, the symptoms are all over the place. But this one guy I'm thinking of in particular, this is the first guy I've ever heard this happen, where he just felt like there was this light switch that went off that he could not turn on. It always felt like he was like almost like in a speed racing scenario, like he's playing a game, or just things were just couldn't turn off the adrenaline. I think it was like that's what was flipped on, and it turned out to be a mold issue. But at the same time, like it turns up. It's just so difficult to pinpoint. Like if someone's walking around anxious all the time, which there's a ton of people like that for whatever reason, it's like it's so tough to pinpoint.
But it's working through. I mean, like that's the point of of listening. I mean, again, I said maybe I would one time I would have said 10 years, but things are moving so fast. Maybe in 2 years, I'll be easily replaced by AI because it'll have all the algorithms. It'll know. But otherwise, that's why you need doctors who listen to these stories long enough that you're not going to be right in the beginning 100%. But you kind of, things have flavors. And you listen and again, you test and you see what's the most likely things that are on top, and what's and just knowing that just because you get I think the most important thing, just because you get a positive Lyme test doesn't mean the first thing you should do is treat the Lyme. Sometimes, but you got to look at the context, Because if the person, like you say, if this fellow's walking around feeling wired all the time,
Yeah.
when you activate your immune system to start to kill something by, because when you give like an herb or an antibiotic, it's also triggering your immune system to join in,
Mm.
because when things start to die, the signals given off, trigger your innate immune system, and then the acquired, then everybody comes in to join the party. But that creates those same signals that go to your brain that go like, oh, this isn't safe. And if you're already in the midst of that, it's sometimes not pretty.
Yeah.
That's why layering therapies, figuring out how to first, that's why we use, people use peptides and things to, and a lot of, the antihistamines if needed and the herbs to try to quiet things down sometimes first before you can go back in and try to eradicate something,
Mm.
but in things that are environmental, such as mold, I mean, especially if you're living, and it could be colonized you, and that's a whole other story, but just getting out of the environment, if you're in it, is crucial. And that's the hardest thing to do, because I probably the most difficult conversation to have with someone is when you realize that their house is toxic.
Right.
Because
So what do you do?
what do you do? Okay, it's easy for me to say, but your whole life is going to go upside down. Your whole family's life is going to go upside down. I mean, that's crazy making, and especially like it would be great if we could be, if we're 100% sure it's really nice, but lots of times you're not. And so it's a hard thing, but you have to at least give it a try. You have to get out of the environment for a while and see if
Mm.
it makes a difference. So it's funny. I'm not that mold centric, but you pointed out that if we don't deal with the mold, if we don't acknowledge it and remove yourself from the irritant, nothing
Yeah.
else is going to work well.
Yeah, I don't know. Just like it seems like that's the common thing, and you're not the only one. It's just it
Yeah.
seems to be bubbling up so much more in conversation now. And yeah, the
because
mold thing.
because I personally believe that there's underlying infection that changes how your immune system, because we co-evolved with mold again. I mean, with all these bugs, they didn't appear today.
Yeah.
I mean, our houses, the way we set them up, and how we set them up to have individual molds grow, and that's part of the problem. When a mold has to be in a complex environment, it doesn't have a lot of energy to spare, and for some reason, molds and those single cell organisms, when you give them lots of food and nothing to fight, they make toxins, which is weird because these are their self-defense chemicals. But for some reason, they make a lot of it when there's nobody around, just lots of food.
Interesting.
And so our new environment has done something, but I really do believe that it's often underlying tick-borne illnesses that change our immune system that then does something. I mean, I said I don't know all the ins and outs, but it's just what I see,
Yeah.
that's usually the trigger. It's and a lot of it can just be the other toxic load, because that's why it's so different in the family. Because even though we have quote unquote very similar genes, they can be different enough, and our own exposures to mean the difference between one person, feeling terrible, and the other person thinking nothing wrong here.
Yeah. So let's end it on this, Eric, is if someone's listening or watching right now and they feel like they might be, they're stuck. Maybe they're a little tired. They're feeling inflamed, or they've heard that they're feeling foggy. Where do you think, and maybe just kind of like a top answer, we don't have to go super deep unless you feel the need, like where should they start if they're feeling that right now, this stuck feeling?
Well, I think the simplest thing, if you can do it, is just go spend a day sleeping on the beach.
Ah, I like that.
It's funny because often, they're right on the beach where the water's there's very little mold in the sea air. You know,
uh,
I mean,
uh-huh.
if you go inside somebody's old bungalow, that's a different story. You know?
Right.
Uh,
Right.
or just try to move. Like get into a clean environment. I mean, well, the best thing is go into nature and just see how you feel. Um, I know you got to be careful, because if you're really sensitive to mold and you're out in an old forest with a lot of old leaf mold on the ground, you could, because that's cladosporium is one of them leaf molds, and So that could cause a problem. That's why the beach is a good place, because you're going to take care of the mold issue. But getting outside, I mean, I think if you can, have the resources to get a few days in a place where you can be outdoors all day, and that can give you a good idea of how much the environment is playing a role in in what you're feeling. I mean,
Yeah. Yeah.
obviously most people feel a little better just because they're in a different environment, but especially if you have odd symptoms, if they are really going down, there's a good chance that your environment needs to be looked at. And it's not just mold. There's lots of outgassings. I mean, so many people, I mean, the IKEA furnished life. I mean,
Yes.
is
Carpets and
all
yeah.
that stuff. I mean, like the yeah, just the chemicals. I mean, this is we were talking earlier about, like, all those toxins you measured. Well, a
Right.
lot of them are coming from your furniture.
Yep.
Okay, we don't think about that.
Yeah.
So,
That new
uh,
car smell, huh? We
yeah,
all
that
love
nice. Yeah,
cars.
well, I mean, well, to most people have an idea that that nice new car smell isn't such a good thing, but
That's so good. Yeah.
yeah, but they don't notice it. And as we get older, and especially men, not all, but men tend to have not as high as good sense of smell. At least my
Mhm.
experience. I don't want to admit that's not. I don't know if that's a medical fact, but
I've heard similar, but yeah, who
yeah,
knows?
I always like to be clear about, like, what I think I know and and that's one of my think I know. But to be aware that that's why women often are more sensitive, because those smells are setting off alarm bells, and we might be
Hmm.
too dumb to notice them. But
That's right.
and so just like the guy who's not paying attention to, like, the fact that there's a fire coming over the hill, he's still happy. And the person next
Not
to him
doing anything.
doing
Yeah.
it can be really anxious.
Yeah.
It doesn't make the happy fellow necessarily the smart one there.
No. Or safest, yeah. Well, I think that's great advice, Harry. It's a good way to leave it here too. And me, AI and all this stuff, maybe that just allows us to get outside more if it saves our time and helps. That's another topic. That's where I do it out in my other side project.
Yeah, let's hope. I don't know. I tend to be optimistic, but it's only because I'm old and I don't have that much to worry about it.
Well, that's a whole nother conversation. But Eric, where can folks go? And because I know you're doing some cool stuff, where can they follow along?
Okay, well, where do we find? We're at gordonmedical.com, and there's a little button there that says probably something like uh, you know information call, or new patient court. And the thing is, you
Uh,
get to do is you get to talk to someone in our office who actually knows what we do and can talk
nice.
to you and really let you know whether we're a fit. Because if there's lots of problems, we'll be glad to send you to other places and other programs if you don't need our level of experience and work, because lots of things can get people well. Okay, and there's lots of online resources, and we try to have that available to people, to go find simpler solutions, because we're
That's
we're
nice.
we're we're out there to to just help and share with other doctors how to do our best in this complex world. Um,
It's complex, and you mainly focus and work with people with chronic illnesses, correct?
Yeah,
So those would be like
that's
most.
what we do. That's what we
Yep.
do. I said, if
Awesome.
you've got simple problems, you know, it's not that it's not fun to treat people with simple problems, but we've evolved our whole system to the point, like, it'd be kind of, I think it would be a waste of your money
Fair.
and
Fair.
resources. There's
Good
better
for
ways
you.
to do it.
Yeah. 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 Well, that's awesome. So, gordonmedical.com, go check it out. And I know you collaborate with a lot of, Dr. Savage. I see Dr. Jill on here, Carnahan,
Yeah,
and Dr. Paul Anderson. These are folks that have been on this show too. So
yeah.
go check out everything there. I think it's
Yeah.
Gordon Medical Forum as well, .com.
.com,
And
and
it's
we have another website that it's called Plasmapheresis West, for those people who have chronic complex illnesses and are interested in a sometimes slower and gentler form of plasmapheresis. If we think
cool.
that's going to help you, I don't think it's for everybody, but it's out there. It's available.
Well, hey, Eric, thank you for your time and your wisdom that you shared here, because it got me going in all different directions to explore more. So appreciate you very much, my friend. Thank you.
Pleasure.